Hello guys, I wonder what is Marcus gun jaw winking phenomenon is all about? Do you have something to share, Julie?
It is a rare phenomenon happened, madam. It is not genetically inherited and it is usually happened in unilateral and rarely happened in bilateral. That is what I know, madam.
Let us see some of the clips or interviews about this phenomenon.
Marcus gun jaw winking phenomenon.
Sure, yeah. Check this out. Come on. What? What is? Julian Marcus gun jaw winking. Let's see.
Assalamualaikum everyone. I'm your host and today's slot is about Marcus gun jaw winking phenomenon. Let me brief you about the background. Marcus gun jaw winking phenomenon. It can be defined as one of the type of congenital ptosis, which is a dropping eyelid, physical abnormality which is present at birth, associated with the winking motion of affected eyelid on the movement of the jaw. In 1883, a man named Marcus Gunn came across a 15-year-old girl who is suffering with this syndrome, and it is now bears on his name. Okay, let us hear some of the points from the perspective of the doctor on this phenomenon.
Marcus gun jaw winking phenomenon may be elicited by the opening of the mouth, thrusting the jaw to the contralateral side, jaw protrusion, smiling, chewing, and sucking. This phenomenon is oftenly discovered in the early age as the infant is bottle feeding or breastfeeding. According to Dr. Hamidah Budin, the ophthalmologist, she said that the pterygoid muscle here, is associated or is aberrant to the muscle of the jaw, which is here. So the jaw will affect the motion of the jaw will affect the motion of the eyelid. So in other cases, the muscle of the eyelid is weak.
What is the relationship between the brain and the phenomenon? Let us ask a medical student about this.
Okay, from the perspective of the eye specialist, Dr. Hamidah Budin, she said that the brain is functioning well while the peripheral nervous system is affected, in which the nerve to the eye is aberrant to the jaw. Thus, it affects the movement of the eyelid when the jaw is open.
I know that Marcus gun jaw winking phenomenon can be first noticed while the baby is bottle feeding. Is there any symptom for this phenomenon?
There are symptoms of Marcus gun jaw winking syndrome, which are A. Mild to moderate blepharoptosis, usually unilateral, and B. Synkinetic upper eyelid movement with jaw winking after one of the following. It is usually first noticed by the parents about the phenomena while the baby is bottle feeding and breastfeeding, and worse in down gaze.
The diagnosis of the phenomenon, which is the Marcus gun jaw winking syndrome, can be done clinically, and they need to see or consult doctor first, or especially the eye specialist.
There is a treatment for this Marcus gun jaw winking phenomenon. What is the treatment for this phenomenon, doctor?
Okay, the Marcus gun jaw winking syndrome is treated surgically, with the specific operation being based on the amount of ptosis and the strength of the levator, which is the lifting of the muscle. And if the ptosis is mild to moderate, surgery will usually be performed when your child is school age between 3 to till 5 years old, and if the ptosis interferes with your child's vision, and surgery will be performed at an earlier age to allow proper visual system development and to prevent or minimize the amblyopia, which is the lazy eye.
What is the prognosis of this phenomenon?
the prognosis of the phenomenon can be treated through surgery, and but the surgery is quite complicated, and some of the surgeons said that it may be difficult to get the good symmetry between the eyelids unless both eyes are operated on.
Let us see what is the opinion of the patient's mother of Marcus gunn jaw winking phenomenon. Excuse me, madam. Yes. What is your opinion about your son?
I am the mother of a patient who has Marcus gunn jaw winking syndrome. I know that my son has this syndrome when he sucked a bottle of what we call one of his eyelids move upwards and downwards, together with the opening the motion of the jaw. And my son's condition is not a severe Marcus gunn jaw winking syndrome, in which he does not have to go for surgery. It is just his eyelid drops slightly, and the reaction of people about my son's condition was that they shocked at the first place, but later on they see it as normal. Nevertheless, some of them made a weird faces when they saw my son's condition.
They should respect other people too. Marcus gunn jaw winking syndrome patients do have feelings. My son feels inferior when he needs to meet people. Psychologically speaking, appearance of the Marcus gunn jaw winking syndrome patient do affect the patient's confidence, level, and in a negative way. Thank you. In short, we can say that Marcus gunn jaw winking phenomenon is rarely happen. This is all about Marcus gunn jaw winking phenomenon. Name one of the symptoms of Marcus gunn jaw winking phenomenon. Second question is, what is the treatment offered by the doctor for Marcus gunn jaw winking phenomenon?
Okay, that is interesting. What a wonderful new knowledge. Julie, you know that Marcus gunn jaw winking phenomenon is first noticed by the parents while the baby is bottle feeding.
Yes, madam, it is true. The symptoms are worst in down gaze, and it can be seen when the mouth is opening, jaw movement toward the contralateral side, chewing, sucking and swallowing.
The treatment for this phenomenon is surgery. The diagnosis of this phenomenon is congenital ptosis, which is the dropping eyelid. Surgery is needed when it is covering the vision.
Yes, madam, they usually do the surgery for the function of the eye and the cosmetic reason. The patient of Marcus gunn jaw winking syndrome always feel insecure to meet people.
The brain is function well, but the muscle of the eye is aberrant to the muscle of the jaw, which the eyelid is affected when the jaw is moving. It is about peripheral nervous system.
Oh, I see. The prognosis of the Marcus gunn jaw winking syndrome is the surgery can be done, and it is quite complicated, by the way. It can be treated by clinical surgery, madam.
It is new information about Marcus gunn jaw winking syndrome. I really want you, Julie, to do a research on this phenomenon and post it in your blog and YouTube account, okay?
Okay, madam. I will do the research on this phenomenon. The video is really helpful. Thank you, madam, for the consultation. I think this is a new information for me. It is cool. Yahoo!